Well, other hospitals in Northern California also have plans in place for distributing the vaccine, but they also tell KCRA3's Brittany Johnson that those plans are fluid, and she joins us live with what that really means. Brittany.
Well, it means that the plans are evolving and changing on a daily basis as more information does become available. So I was able to obtain some of that information from some of the hospitals around here in Northern California. I do want to begin with Placer County tonight. It has submitted the required vaccine plan to the California Department of Public Health. The plan does not require approval from CDPH. Placer County is working with Sutter Health and Kaiser Permanente on receiving initial allocation, but does add specific receiving details of which mail carrier Placer will receive COVID-19 vaccines from is not available at this time. And as for any practice runs Placer has done regarding shipping, receiving, handling, or storing the vaccine, I was told the county routinely receives and stores vaccines as a component of its usual immunization activities. Now, Placer has conducted both flu clinics and back-to-school vaccine clinics, preparing them for other vaccine clinic endeavors. And many of them say staff, the same ones who developed and implemented the H1N1 vaccine campaign, are developing the current COVID-19 vaccine campaign. Let's move over to San Joaquin County. Health officials there submitted their plan to the state but haven't received a response. Now, it expects the first shipment to arrive Tuesday, December 15th, and supplies were already sent through UPS, but San Joaquin isn't sure yet about the exact shipping method of the vaccine itself. Now, the county has been developing plans and preparing for a COVID-19 vaccine over the last few months. And finally, we did hear back from Sacramento County today. They say early indication is the county will receive 14,625 doses of Pfizer. Now, most of its initial allocation will go to hospitals, and 9 different sites are enrolled for early allocation. Most county sites are equipped to receive the Pfizer vaccine, which must be stored in an ultra-cold freezer. The Moderna vaccine, which should follow closely behind the Pfizer vaccine, is stored at frozen temperatures, and I'm told most clinics have the capacity to meet this need. Now, Sac County says there are teams of nurses that are trained in vaccine storage, handling, and transport. Now, again, most of everyone that I did reach out to today did refer me to the California Department of Public Health, and I asked them for more information, detailed information on the state's step-by-step plan to distribute this Pfizer vaccine, and that includes information on which airports are going to be receiving the Pfizer vaccine and which mail carriers are going to help distribute. And also do remember that Pfizer, this still needs the stamp of approval from Governor Gavin Newsom's committees that he puts together. So I also asked CDPH if that is going to delay any vaccine distribution. A spokesperson did get back to me. They've received my request for information, and they said, again, they will get back to me. So as soon as I get that information, I'll be sure to pass it along. Back to you.
Yeah, as they've been answering that along the way, they have said that they're making their recommendations right along with the federal government. So they're not expecting a delay, but they continue to be great questions to ask. Brittany, thank you.